Thank you very much, and welcome to all who are listening today. And I would like to thank the Open Data Institute for inviting me and on behalf of WHO to speak to this year's summit, which is with such an important focus on the relationship between data and people. Every data point is a person, a place, an event. It tells us a story about our lives. I want to begin by recognizing the important work that ODI is doing to drive better data for better health outcomes. We have entered the decade of action. The last 10 years before we reach the 2030 deadline for the 17 Sustainable Development Goals. And we are already nearly 8 years away from that deadline. Tragically, the COVID pandemic highlighted the glaring inequities, striking data gaps, and fragmentation that we cannot afford to ignore. And it has also threatened to reverse many hard-won gains we have made in the last several decades, not just on ending neglected tropical diseases, communicable diseases, reducing poverty and malnutrition, and improving access to better healthcare and education, risking about leaving tens of millions of people behind on the path towards the sustainable development. As of today, you are tracking of the 7 billion COVID-19 vaccine doses administered to date, 4 billion people are still unvaccinated, and more than half of these people live in lower and middle income countries. Yet, even these figures are only as good as the health information systems that report them. We see this story repeated in this story of COVID deaths, which rely on modeling to gauge the true impact of the pandemic on human lives, on the impact of the pandemic on human lives. When we don't count, we don't know. We don't know where we should invest, and therefore the inequities deepen. And this is happening every day around us. And when we don't count, we can't be accountable for the results. As we emerge from the shadows of COVID-19, which has underscored that, yes, good data is the lifeblood of public health. And we have a tremendous opportunity to create a healthier, more equitable world through both data, innovation, and partnerships. I often say data tells us where we stand and what stand we need to take. But this cannot be done in isolation. When we stand together in unison towards a common vision for a better future, this is when true change happens. As the theme of this year's conference illustrates, health data is fundamentally about people. But it is also about political will, policy execution, and solid preparation. Today, I would like to discuss 3 areas that, in my view, will deliver maximum impact to ensure no one is left behind. We want to see numbers towards a positive trajectory, number of people living healthier, longer, fulfilling lives. We want to see more lives saved due to preventable diseases and risk factors. And we want more countries, number of countries better prepared to deal with health emergencies. But all of these three goals truly rely on data quality, data coverage. We need to liberate data. And finally, we need to use data to deliver impact. First and foremost, as I mentioned, data is more than numbers on a page. It represents a person from cradle to grave, but everything in between. Death is a fact. Birth is a fact. These are the bookends of our lives. But it is very important that we track what is happening in between this, and how do we keep people healthier, provide access to healthcare when it is most needed, high quality healthcare, and prevent from emergencies. With regard to data quality, something as fundamental as counting deaths, the CRVS, Civil Registration and Vital Statistics systems, are not optimal. 4 out of 10 deaths are registered globally, and 9 out of 10 deaths are not registered in African countries. This really limits us to quantify why people are dying, or the cause of death is compromised significantly. Countries have reported last year in 2020, there were altogether 1.8 million deaths due to the pandemic. But the excess deaths when we reported just for last year were 3 million for 2020, which is a significant 1.2 million excess deaths. And today, the excess deaths that are being reported are in range of 9 to 12 million deaths, whereas official reported deaths today count to about 5 million. So these are the challenges that we are facing. A simple fact of life to quantify deaths, we are unable to do as a global community. We report births well, but we are not yet reporting deaths and causes of death. And that really limits governments to direct resources and invest in areas that can truly save lives and improve health. We also don't know who's left behind because of the quality of data. It is difficult to disaggregate data. And we don't have disaggregated data for over half of the health-related SDG indicators. And we have a small window of opportunity. WHO worked with many partners and countries to do the first global assessment of countries' data and health information system capacity. We know where the gaps are. Simultaneously, we introduced tools and technical packages, which is coined as the SCORE for Health Data Technical Package. SCORE stands for Surveillance, CRVS, Optimizing Routine Health Information Systems, Reviewing Performance, and enabling use of data to deliver impact. It's a very smart technical package. We know where the gaps are, and we know what the tools are that are needed to fill those gaps. What is missing is political commitment, investments, and coordinated action by partners around the world. The other issue that we are facing is that we are not sharing data optimally. Health data must be a public good, and I love the title Open Data Institute. We must liberate data. And what do we really mean by liberating data? It is about fundamental access to data to drive and improve performance of care and policies. But at the same time, it is important to protect the individual privacy. And we have technology at our disposal that can help us do both, make data open, but also ensure through good data governance that we are truly respecting human rights and privacy of the individuals. We are working towards a World Health Data Hub, which will be launched in few months, which will make data on health available to everyone, everywhere. Join us and contribute to the World Health Data Hub. And finally, my third point is what is good to have high quality data and access to data if we don't use data in real time to drive and improve health of people and drive proper public health policies. Too often, data is collected, analyzed, reported, often perhaps 1 or 2 years later. What we need is a real rigorous mechanisms to use baselines, targets, and track the trajectories through real-time data to know what policies are needed for what risk factors or diseases. Delivery is extremely important, and technology comes handy here. For example, geospatial information systems are very crucial and can provide that timely access to data. We have, through GIS systems, access to map health facilities, which we did during the Ebola outbreak, and we have now used for neglected tropical diseases. Recently, venomous snake bites, which is a neglected tropical disease, which takes about 138,000 lives annually in tropical climates and countries with tropical climate. This can be prevented, and what has been done using technology and geospatial information is to catalog the snakes that are poisonous, to identify health facilities where antivenom is available, and to design and the distance and the location, how to reach the victim from the point to the health facility in a matter of a short time that truly can save lives. This is to just give an example that it is truly important to bring public-private partnership together, where we can access innovations and technologies and tools to accelerate addressing the data gaps so that we can use data to truly drive public policies to improve health. Partnerships such as Health Data Collaborative and the SDG Global Action Plans reflect this commitment and have truly helped accelerate by ensuring global resources are aligned to country needs. Another important lesson is the importance of open data, data that is timely, reliable, disaggregated, and accessible to ensure no one is left behind. Friends, we are truly now at a tipping point. Either we revert back to the status quo, which we cannot afford, or together we forge forward to bring systemic, sustainable improvements that will truly strengthen every country's capacity so that every country will score the highest score in health data and in information systems. And it is possible. When we say that data truly is the lifeblood of public health, we can see that this is no longer really a question whether it is or it is not. Without blood, we have no oxygen, and without oxygen, we have no life. If there is no data, we are truly shooting in the dark and hoping we hit the target. And this can have life and death implications. Without data, people remain invisible and uncounted in many parts of the world. On the flip side, we have many examples of good health data from supporting countries, learning from countries, getting rid, for example, of lead paint or lead in the paints or asbestos in the walls, to introducing effective tobacco control prevention measures, to safer cars with seat belt and airbags. There are a million more stories with happy endings, and that is thanks to the power of good data and good data governance. Now is the time for us to be frank and honest about our challenges, share the best practices, and lift up those who are most at risk of falling behind, so that maybe 100 years from now, we need to have the foresight that COVID will not just be a story of tragedy, but also one of resilience, resolve, and renewal. And we can do this together. And I am optimistic we can.